Yeah, so we're going to be debating, about transplant oncology and the use of liver transplantations as a means to treat patients with intrahepatic cholangiocarcinoma and colorectal liver metastases. And, the field is moving very rapidly. There's been huge changes in the field of oncology, in the last 20 years for these cancers. There's a lot that we know in the world of liver transplantation on how, to have long-term survivals for these patients. Even technically, today a liver transplant is a very well-tolerated procedure. So for that reason, we've learned that in some patients with intrahepatic cholangiocarcinoma that are, treated on therapies, these are very selected patients, some of them that have favorable mutations, we can actually, keep them on systemic chemotherapy for a long time. And if they have liver-only disease for a period of time and they're very stable, actually, transplanting them, and this is always in patients that can't be resected, they can have surgery, actually can have promising outcomes. The data on cholangiocarcinoma is still, being produced, and it's still in early phases, but with a huge revolution there is on therapies and in understanding more the molecular biology of these tumors, I think there's going to be more cases that may benefit from this treatment. And it's a little bit similar to with patients with colorectal liver metastases. We clearly know that the only potential for long-term outcomes or cure for these patients is the combination of chemotherapy and surgery. And in those that we can't operate, or the only way to remove these metastases is to actually remove the whole liver, a liver transplant has been shown to be an effective therapy. And there's more and more centers doing this, including ours in Toronto, where we've done several cases of patients that are doing they're years after the transplant with no tumor recurrence, and we think that as a local therapy for some of these patients that can have surgery is a very good treatment.